You're watching the Microsoft US Health and Life Sciences Confessions of Health Geeks podcast, a show that offers industry insight from the health geeks and data freaks of the US Health and Life Sciences industry team. I'm your host, Claire Bonacy. Today, we begin a series with Molly McCarthy, our Chief Nursing Officer, on the year of the nurse and midwife and why it's so important. Hi, Molly. Welcome to the vlog.
Hi, Claire. Thanks for having me. It's great to be here.
Okay, so why is 2020 the year of the nurse and midwife?
Sure. So the World Health Organization designated 2020 as Year of the Nurse and Midwife to raise awareness of nurses and midwives' significant and varied roles within healthcare, and also increase the investment into the nursing profession. The year 2020 was selected to honor the 200th anniversary of Florence Nightingale's birthday. Not only was Nightingale a significant contributor to the field of nursing and healthcare reform, she was also a pioneer in the graphical representation of statistical data.
Okay, great. So why did the World Health Organization launch this initiative to begin with?
Sure. So nurses and midwives actually account for nearly 50% of the global healthcare workforce. And in the United States, there are approximately 4 million nurses in a variety of roles and settings, from tertiary care centers to home health, academia, schools, industry, and within our communities. Nurses are really critical in healthcare delivery system, regardless of the country, as they truly care for patients and their families from what we sometimes refer to as womb to tomb, really, so birth through their entire lives. The initiative specifically calls out 5 investment areas, and within those investment areas, it's really a global effort to, one, invest more nurse-led and midwife services, enabling nurses and midwives to work to their full potential. And really that means to work to the top of their license. The second one is to employ more nurse specialists. Third, make midwives and nurses central to primary health care, providing services and supervising community health care workers. Fourth, support nurses and midwives in health promotion and disease prevention. As we know, nursing really focuses on not just that acute care setting, but really throughout the lives and improving the wellness as well. The last one is invest in nursing and midwifery leadership. So there's a group, for example, called Nurses on Board Coalition. So there's a lot of efforts going into these 5 different areas. In addition, in April, the World Health Organization is going to publish a report on the state of the world's nursing. And this report, according to World Health, will provide a global picture of the nursing workforce and support evidence-based planning to optimize the contributions of this workforce to improve health and well-being for all.
Wow, that's great. I honestly had no idea that they make up over 50%. So that's really impressive. I had no idea. We should be paying more attention to nurses and midwives. So why is the year of the nurse and midwife important to Microsoft overall?
Sure. So the Year of the Nurse and Midwife is really significant to Microsoft. We've historically celebrated Nurses Week, May 6th through 12th, really for the past several years, and we're really excited to dedicate 2020 and beyond to amplifying nurses and midwives' stories and influence in health and care. And of course, for Microsoft, their influence and contributions in innovation and technology. The World Health Organization designation for 2020 really solidifies Microsoft's position that nurses and midwives are critical to the delivery of care today, as well as when we think about and talk about next generation sites of care, whether that be the home, the clinic, the hospital, the retail clinic, etc. So nurses and midwives are crucial as Microsoft continues to collaborate with healthcare delivery networks, with our health plans, with life science and medical device companies to design, develop, and implement technology across the care continuum. I truly think that nurses' input and really all clinicians' input and feedback is so important throughout the product development cycle, and the real world experience is truly invaluable. And so as Microsoft seeks to be a more diverse and inclusive organization, I really can't think of a better time to celebrate the Year of the Nurse and Midwife and really integrate them more into our design, development, and implementation of solutions.
That's great. I know this is very personal for you, and as it is for many people on the industry team, so I'm really glad that Microsoft is fully behind this as well. So since it is Year of the Nurse, what can our viewers expect over the next year?
Sure. So our goal at Microsoft on the health industry team, really each month is to highlight nurses' abilities to maintain that high-touch, caring environment while also using high tech to achieve the quadruple aim. We're excited to share technology use cases from varied care settings and feature different roles nurses play in innovation and technology. We'll also introduce opportunities for continuing nursing education in conjunction with a large organization that will be announced next month at HIMSS. And we're also an avid supporter of hackathons, and we're looking to pursue this idea with a potential partner. And obviously, we're very open to other opportunities as they arise throughout 2020. And we do have some events planned in May, specifically around Nurses Week. So for me personally, I'm really excited and proud to be working with my passionate Microsoft colleagues here in the US and really across the globe to highlight nurses and midwives' impact on the health and well-being of patients through the use of technology. And so I hope to see some of you guys at HIMSS and at the American Organization of Nurse Leaders Conference in March. And just a reminder, we will be at the Nursing Roundtable on Wednesday, March 11th from 4 to 6 p.m. So thank you so much.
Great. Thank you so much, Molly. I'm really looking forward to continuing the series with you next month. So thanks so much.
Thank you. A pleasure to be here.
Thank you all for watching. We look forward to continuing the Year of the Nurse series next month with episode 2. Please feel free to leave us questions or comments below, and check back soon for more content from the HLS industry team.